Okay, first I'd like to thank you, Professor, for allowing me to have an extension. I did end up in the hospital for a couple of days with an upper respiratory infection, but no COVID. So today I'm going to talk to you guys about staffing ratios in the medical field. I'm a CNA, so I work in the medical field. I work very stressfully during this pandemic, and with the lack of staff already, it just makes it worse with there being no staffing ratio. So, what is a staffing ratio? A staffing ratio is a ratio of care providers, whether that be nurses, CNAs, techs, whatever. A staffing ratio is your ratio to patient, your ratio of caretakers to patients. So an ideal ratio would be 1 aide, nurse, whatever your policy is for your building, to 10 patients or less. It gets a little hectic after 10. Iowa is currently one of the states that does not have a staffing ratio. And during the pandemic, that really caused some problems because, excuse me, because with everybody being sick and people getting the coronavirus or being exposed, they had to quarantine, which left 1 or 2 aides to 32 people, which is very hard and stressful. However, many states in the United States are fighting to get that ratio. Iowa is one of them. A lot of nurses and state evaluators and legislatures are fighting to give the medical field the help it needs and deserves. We're on the front lines of everything. We're taking care of everybody. We're taking care of your loved ones. We need a staffing ratio. Why doesn't Iowa? Well, currently, because our economy doesn't allow for staffing ratios, it doesn't really, we don't live in a rich state. So Iowa has very tight budgets, especially in the nursing field. That means you can only have so many people on the floor for so long, and you have to fulfill working hours, and you have to divide them equally between staff and try to get each shift covered the best you can. A lot of people don't see the need for staffing ratios because they've never had to work firsthand in our field. Lawmakers have no personal experience, which if they had personal experience, I'm sure that they would be more apt to fight a little bit harder to help us. The problem with this, not having a staffing ratio, is, well, you have less required staff, which means more possible staff injuries. Transferring 2 people transfers by yourself when you don't have enough staff, or not being able to step back and take a break when you're frustrated or you just need a breather so you don't hurt yourself. It creates employee burnout because, again, less staff means you're working more hours, required overtimes, picking up to make sure that the other shifts don't have minimal aides or nurses or whatever. It causes a lot of emotional distress in workers. It can cause some psych problems, some depression, some anxiety, some moodiness. It can cause feelings of hopelessness and worthlessness, especially if you're not able to answer call lights on time and being able to being able to get to your residents or patients as quickly as you'd like to. It can also cause injury of your residents, your patients, whatever you call the people you serve. You could be rushing to get them to the bathroom or off the toilet or into their bed or into the shower. You could hurt them and hurt yourself at the same time. My personal experience is at a facility that I worked at. It was pretty close to 20 to 25 patients, residents, to just 1 CNA because we were so short on staff and people refused to come in and help out. I did have a coworker, because of this incident, receive a severe back injury in which she had to have surgery. She's having physical therapy. It's just a hot mess for her. She is going all the way to court to try and explain why we need more staff. And another personal experience is when we don't have enough staff, we have to have mandatory overtime. And that mandatory overtime can cause a lot of burnout and stress, and you're missing out on things, and you're possibly harming your residents, the people who you serve, because you're so burnt out and tired. So why should we create a staffing ratio? We should create a staffing ratio because our patients and residents deserve the best care. They are the number one priority when you're at work. We should be able to have enough staff to take care of them adequately in the way that they deserve. Making sure that they're clean and dry and lights are answered accordingly. It would increase staff enjoyment, decrease burnout significantly, and reduce injuries, which means less workman's comp cases. So again, thank you. I hope that I was able to shed some light on you on this situation. This is a countrywide situation. It's not just an Iowa situation. It's not just a my facility situation. It is everywhere. Again, thank you for the extension. I am so thankful. I am finally feeling better. And thank you for such a great semester.